Hey, my name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. For now, we're moving to Tempe, probably late August, early September. I'll keep you posted. Today, I wanted to talk about something really, really big. I can't believe it's taking me this long to bring up. But before I do, you wouldn't mind just click that button there to subscribe, and we'll move on. So, PCOS, Polycystic Ovarian Syndrome. That's a huge one. I can't believe it took me this long to bring it up. I think a lot of it is because it's one of those things in practice where I see it come into the clinic. I'm like, oh yeah, all right, we got this. And I know what to do and we navigate through it. And it's not a really big thing anymore in my mind, because that's what I do. And I see it and I understand it. And this is my approach to it. And so I'm very comfortable with it. So I rarely do I, see it as like, oh, PCOS and, but I know many of you, it's huge. It's never been lost on me, the impact it has on a woman's life. Never been lost. It's just when I see it in the clinic, this is what we're doing here, and this is what my expectations are. And generally it goes really well. I want to share with you why it goes really well in my clinic. I want to share with you how I see it. What's different in the way I approach it than the way you're being approached now if you have PCOS? And how can you integrate these things into your current care plan with your current care provider, or what you should be asking for from your current care provider regarding your care around PCOS? So that's the sum of what I want to discuss. And I thought about this, and Justin and I had a long conversation regarding it. I could do a one-off reel on this and just bang out some points on it, and that's it. But polycystic ovarian syndrome is big. There's a lot of facets to it. And I don't want to just give you reels where I complain about how it's being treated. Because part of what I do when I do these reels, when I do these podcast episodes, I think it's so important for me to validate you and say that what you're experiencing is real. Having a doctor validate you and share with you the biological reasons why you're experiencing what you're experiencing is an empowering thing. Because so many of you have been, gaslit. You've been told that that's not real. You've been, dismissed. I've seen this. I'm not blind to this. And so I've always felt it's important to validate you, connect with you. But that's only part of it. I really want to deliver meaningful, helpful information that'll have a positive impact on your lives. That's my goal also. So with this, Justin and I decided to expand out a series of episodes dedicated to PCOS. Today's just gonna be a little introduction. I'll kind of go over, some basic stuff about it, my history of treatment, and then just my view of it. And then the next one will just kind of progressively move from there, and we'll do one a week. And then you guys know this, and I want you to know this. If you don't know it, you know it now. If I bring something up and it doesn't make sense, or if you want me to drill down into one aspect of PCOS in this case, write us a message. Send me a message. Let me know. I'm not doing. He and I are not doing this for us. I mean, we are. I mean, I get such joy out of doing this. I really do. But we're doing this for you, and that act of service, that's the benefit. That's what I love. And I love seeing the positive impact it has. This is what drives me. This is what feeds me. This is my thing. So with that said, let's drill down into PCOS a little bit. Polycystic ovarian syndrome is a condition that affects okay, let me put it this way. It is one of the most important components of infertility that needs to be ruled out and treated. Polycystic ovarian syndrome is a huge component of infertility in women. Polycystic ovarian syndrome plays a massive role in not just fertility, but just overall health in women, because it affects more than just reproductive health, but it's also, their endocrine health regarding blood sugar metabolism, cholesterol metabolism. It's very important to care for that. Sadly, and I hope you all know this, it is very sad, but there's so little research done on it yet. We don't have enough research on it. We have some research on it, but not enough. And so that's why when you go to your doctor's office, sometimes you don't feel like you're really being seen or cared for. What is polycystic ovarian syndrome? When they say polycystic ovarian syndrome, what they're saying by that term is that when you look at the ovaries, there's numerous cysts that have been found around the ovaries. Okay, polycystic ovarian syndrome. And that's the physical sign they would see in women who have a cluster of symptoms that are associated with this disorder. And that would be not having a normal cycle, so having multiple periods of time go, months in many cases, between periods, having elevated androgens in their body, which would be testosterone, dihydrotestosterone, DHEA, etc. And it would be elevated levels of insulin. Did I mention insulin a second ago? Very good. Sorry, my brain is working like 1,000 miles an hour right now. So I'm trying to make sure that I give you data that is accessible to you. As a doctor, it's easy to just jump into doc speak and just use technical terms, and I could do it, but that's not being smart. That's just, being smart is speaking in a language that's accessible to the person in front of me, always. So polycystic ovarian syndrome is a cluster of these symptoms, and I want to put you in the shoes of a woman who experiences it for a minute. She's a younger woman. Let's say she starts her periods at say 12, and menarche comes on. A lot of times it's normal in the very beginning, or maybe it's a little bit heavy periods. But at some point or another, it changes, and they're not ovulating. They're not having their period every month. It goes out further and further. And then we do have their periods. It can be very heavy sometimes, painful. They may notice some significant weight gain. They may notice some abnormal hair growth on their body. Just think about that as a young woman, or any woman. Your period's not coming regularly. What's the first thing you think? I must be pregnant, or something's wrong with me. And as you're young and you're first having your period, that's already it's a unique experience to women. That is, I know I'll never experience it. But I have been doing this long enough to know it's a big change. And so you have that happening, and now it's not regular. And now you're having abnormal weight gain, which is absolutely a stressor in your lives. And then put onto that maybe some hair growth that's atypical. Now, how do you feel? When you present to your doctor's office, and say you get your doctor to immediately give you that diagnosis of polycystic ovarian syndrome, which does happen sometimes, and you look that up, you see fertility is an issue. Long-term issues with type 2 diabetes. There's some that'll say there's breast cancer issues associated with it, uterine cancer issues, and ovarian cancer issues. Imagine you're that girl or that young lady. Sometimes it'll be in your 20s it's diagnosed. Feel that. And then what's the treatment? Just put you on birth control. That's what they do. And they put you on metformin. It's your most common protocol these days. There'll be some variances in there, but that's about it. Now, there's nothing wrong with using oral contraceptives if you're giving it to a patient who wants to have contraceptives for sexual activity. That's what it's made for. And I believe we should have better versions of it for women. I believe there should be so much more research on there to give women oral contraceptives that don't have the same side effect profile and have the same problems with it. I mean, for love of Pete, it's been how many decades now, and they still have not come up with any more clever than the same thing. And that's another episode on something else. That's another soapbox I get on. And I have problems with that because I feel like women deserve something way better than that and way more upgraded than that. But still, it is what it is. But if you're giving a woman contraceptives because they don't want to conceive because this is where they are in their life, fine, great. But a kid presents to clinic who's, not sexually active, and you're giving it to them to suppress their natural hormonal balance so that you can get everything to be completely shut down, so that you stop having symptoms. That's an off-label use of contraceptives, and I get its use, and I think that is important to use it there. But do you just put them on it and park them on that and say, that's it, that's your treatment, we're done? That is not good medicine doing that. It may be good medicine in the very beginning to prescribe oral contraceptives to stabilize the patient while you're figuring them out. But if that's going to be your long-term care for that woman, are you really practicing medicine? Or are you just putting a Band-Aid on them? How is that any different doing that than just like pushing a button and That's all it is. You're just doing, you're going to the doctors. They say, you have this, here's your thing. And they're not using any gray matter to understand you. They're not trying to figure you out. So I want you to understand how I figure this out, how we're supposed to figure this out. Before I go any further, I need you to understand one thing. I didn't invent anything I'm about to say. I'm not that clever. I'm not. Everything I'm about to say is just what is supposed to be done. It's just not being done. So when a patient presents to clinic, in my clinic, and she's already been diagnosed with, I'm going to go in with that one. When she's already been diagnosed with Polycystic Ovarian Syndrome, and she comes to my clinic, I know that she has a history of irregular periods, and she probably had bad experiences with her periods. I know she has issues around her weight, and she has concerns about elevated androgens causing hair growth and masculinization that she doesn't want. I know this. I know these are pressure points. I know these are sensitivities she has. So the goal I have for the next series of episodes is going to be explaining to you how I see these women, why I approach them the way I do, what kind of care can we provide to them that's a little bit different than just putting a Band-Aid over it and sending them on their way. I hope you tune in. Please like, share, and subscribe. This is a labor of love on our part because we love doing this, and your feedback helps us drive the content of these episodes. So, thank you again for tuning in, and I'll see you at the next episode.